I had a very long-standing case of Alzheimer's with me, and this patient has been treated by me for the past 1 year. And the patient is of 60 plus, and he's a retired bank employee. He is married, having two children. He's in a very good position when he retired, and after short period after retirement, he was diagnosed with Alzheimer's, and he's been taking allopathic supplements since then. When the disease started progressing, and when he started forgetting things, they thought that some of the homeopathic medication may help, and they have contacted me, and since then they are on medication from me as well. When I met him, the disease has already progressed, and he's in a stage where he cannot even recognize his family members, his wife, his children. He cannot recognize himself, his name, his age, or whatever he is doing. He cannot recognize the daily routines. He don't know where the bathroom is, and he used to pass urine and stool wherever he feels like. And sometimes he'll go into this panic mode, and he used to go out of the home middle of the night, and they literally have put a tracker in his locket, to avoid any untoward consequences. And there is also tremor. His walking is not steady, and he cannot hold things properly. He has literally have to fed the food to be eaten. So all the classical symptoms of Alzheimer's were there, and this is a stage where he met me. So when I started detailing case taking, we always try to figure out the root cause of the disease rather than treating the symptoms. So one thing that stood out in this case was, until his retirement, he was completely immersed in the work, and has constantly been working. He was workaholic. The constant stress was there. The banking, definitely there will be a lot of pressure, and this was his routine for quite some time of his life. I mean, all his life this was a routine. So I figured overwork and the brain fag may be the reason why he ended up in this kind of pathology. So definitely we have gone through the family history, and there is no neurological complaints, neurological diseases in his family as well. So we figured this overwork and overuse of the brain might be the reason why he have ended up where he is today. So we have given him a series of medication, like we have given supplements like Ginkgo biloba, we have given Califos, we have given n number of medications, but the most prominent medication that we have prescribed is acid picricum or picric acid, because this is one of the homeopathic medication that we use for brain fog. Especially if there is any pathology involved with the brain fog, we prefer picric acid. So picric acid was being given in different varying potency throughout many months, and along with many other supplements like Ginkgo biloba, there are like Califos, like there are many other medications that we prescribed. And surprisingly, the progress was quite astonishing. And yesterday they came to visit my clinic, and the patients started recognizing their children's. He is able to do his things. The trauma has come down. His daily routine he can do. He can eat on his own. He can go to the washroom on his own. And the quality of life has improved. I'm not telling I can cure Alzheimer's, but the quality of the life of the patient has improved. The dignity of a person, that is more important to me. It is not about surviving. It is not about prolonging the life. It is about dignity. Restoring the dignity of the patient is one of the most touching thing that happened with this case, and I'm so happy. Not because I could cure Alzheimer's, I could not, definitely, but some sense of dignity has been restored, and I'm so happy about it.